My name is Azim. I'm a reproductive endocrinologist at New York City IVF. I would like to talk to you today about the clinical aspects of egg freezing. And I wanted to start by discussing who should consider egg freezing. So two broad categories of women should consider egg freezing. The first category is women that are affected by a disease or a disease treatment that reduces their fertility. Example of that, cancer of any sort that would require chemotherapy or radiation to the pelvis after surgical removal. So breast cancer being the most common one in the United States. Breast cancer itself does not affect the ovary, but young women are usually offered chemotherapy after surgery, and some of these medications cause exhaustion of the eggs in the ovary, and also the doctor would recommend not trying to get pregnant for a couple of years after cancer treatment. So the combined effect of delay and use of chemotherapy may reduce the number of eggs in the ovary. Another group of women are affected by systemic lupus, or shortly called lupus, and some of them would need chemotherapy like psychlophoshimide to stop the progress of the disease, and that would reduce the number of eggs that remain in the ovary. A reproductive endocrinologist well versed in fertility preservation can actually discuss with you the type of chemotherapy as well as with your oncologist and which one affect your egg reserve. Women that are undergoing bone marrow transplantation also are at a very high risk of totally losing their ovarian reserve, and these should consider egg freezing. And the other group of women are women that are healthy and they are interested in fertility extension because they are not ready to bear a child right now and get pregnant and have a baby right now because of social pressures or career requirements and so on. And although should not be the primary indication for egg freezing, but it is an available option for healthy, fertile women that are interested in postponing having a child at this moment. Question, why egg freezing, why not embryo freezing? To do an embryo freezing, you need to have a partner to fertilize the eggs, or you need to accept using donor sperm. And egg freezing would offer another layer of reproductive freedom to women and empowerment in terms of if you don't have a partner, or you do not want to use the sperm of your partner, or you do not want to use egg freezing. Eggs are under the jurisdiction of the woman that produces them, and then she can use them later on when she has a committed partner and reproduce. When somebody comes to me to talk to me about egg freezing, my first clinical task, in addition to all the other basic aspects of reproduction, is to make sure that if that person receives this much of the fertility medication, will produce this much of eggs that will, when they are thawed after vitrification, will produce this much of thawed eggs, surviving thawed eggs, and will produce this much of fertilization, and will produce this number of embryos that then have a reasonable potential for having a baby in the future. It's not about stimulating somebody, get the eggs and freeze them while the potential for using them in the future and producing a baby is small. So it's as if reading the far future and what is the expectation after that. So I would always want to look at the ovary with a vaginal ultrasound and run an anti-Mullerian hormone level to make sure that a reasonable number of eggs will be produced from a cycle, or sometimes 2 cycles to freeze more eggs. And I also would like to discuss the effect of age on the chromosomal normality or abnormalities that are found in the eggs. So it's well known, as the time goes by, the number of healthy eggs in the ovary becomes less. In addition, the number becomes less, but the number of healthy eggs are less and less. And because of that, usually we do not recommend that people beyond 40 or 41 attempt egg freezing. That's because the number of chromosomally normal eggs produced would probably be small, to the extent that a reasonable expectation of having a healthy baby using these eggs in the future is small. These are very important issues to discuss before even going into the procedure. The other element to discuss is the dynamics of the cycle. So you get stimulated by medicines called gonadotropins. They are similar to the medicine that your brain produces to awaken the eggs in the ovary. And you get monitoring of the response by blood work and ultrasound. The duration of taking medicine is about 10 days. And this is followed by deep sedation and retrieval of the eggs, and the cycle is done. The eggs are frozen 4 to 5 hours later. So this will be the amount of time commitment for the cycle. Another important point I discuss with my patients before proceeding into this: what do we know about the long-term outcomes of egg freezing and the short-term outcomes, and what do we do not know? So we know that with the use of modern methods of egg freezing, which is vitrification or ultra-rapid freezing, quick freezing, the egg does not have time to produce ice crystals in the water inside the egg, and it will have a better quality and better survival when they are thawed. About 90% of the eggs that are frozen survive a thaw, very close to actually fertilized eggs or embryos. And about 70 or 80% of them will fertilize, very close also to fresh eggs. And the embryo development appears to be normal after that in the lab. And the ultimate pregnancy outcome is dependent on the number of eggs and age. Women 38 or less producing 8 eggs or more are at a very, very good chance of having a baby out of the cycle. The long-term aspects of egg freezing are largely not known. And this is what I mean by long-term aspect: 30, 20-year data on the health of children. We know that it does not seem that there is an increased risk of abnormalities in the children conceived from egg freezing, but we only have follow-up data for a few years and on a limited number of pregnancies. Like several thousand pregnancies are present and reported, and indicate that these babies do not show an increased risk of abnormalities. And but we do not have data on the outcome of babies after 30 years, because the procedure has not been out that long. Thank you very much.